Good morning. Welcome to the second webinar in our Reversing CalFresh SSI Cash Out Policy webinar series. Today's presentation will provide a refresher on CalFresh eligibility rules for elderly and/or disabled members. My name is Jennifer Nicholas, and I am the CalFresh Policy Section Chief with the CalFresh Policy Bureau here at the California Department of Social Services, CalFresh and Nutrition Branch, as well as your host for today's webinar. Before we begin, let's go over some logistics. Today's webinar will be in listen-only mode, which means you can connect to audio via your phone or computer, but all lines will be muted during the presentation, which brings me to your next logical detail. How do you ask questions? You can ask questions by using the question pane feature on the right side of your screen. You can submit questions at any time during the presentation. We have a lot to cover today, and we'll have limited time to answer questions at the end of the presentation. We'll do our best to answer as many questions as possible, but if we don't get to your question during the live presentation, don't worry. We're keeping track of all questions submitted, and we'll follow up as needed. I mentioned during my introduction that this is the second webinar in the Reversing SSI Cash Out Policy webinar series. Let me take a moment to highlight the remaining 3 webinars in the series that are coming up over the next couple of months. We'll reconvene on Tuesday, February 19th, to discuss existing CalFresh eligibility rules that apply to residents of institutions. From there, we're going to continue to touch on topics that are particularly relevant for the many newly eligibility SSI recipients we'll be serving as a result of the reversal of SSI cash out, rules regarding the use of authorized representatives, and reasonable accommodations best practices. If you haven't yet registered for the remaining 3 webinars, you may do so on our website at cdss.ca.gov/CalFreshSSI. all one word. If you can't make it live, all webinars will be recorded and webinar materials will be posted, also on our webpage, so check for updates regularly. With that, let's get into our agenda for today. Here's how we'll spend the hour together. I'll start by providing some background information on the policy change reversing SSI cash out. Then we'll provide an overview of CalFresh eligibility rules for the elderly and people with disabilities, starting with a definition of elderly and disabled. Next, we will discuss the gross income test rules. We will then look at different types of deductions, medical, shelter, and dependent care, followed by a brief discussion of categorical eligibility. We will then cover the Elderly Simplified Application Project, or ESAP, separate household rules, and the Restaurant Meals Program, RMP. Lastly, we'll highlight some relevant resources and, with what time is remaining, we'll answer attendees' questions. We have a lot to cover, so let's get started. California's cash out policy started in 1974 when the federal government began the combined federal-state SSI-SSP program. At the time, states were allowed to increase their SSP grant instead of administering what was then known as the food stamp program. California opted for this cash out policy and increased the monthly SSP grant by $10. Back then, this change made sense. It was an efficient way to get food benefits to an eligible population. Under the cash out policy, SSI recipients have been ineligible for CalFresh food benefits because, in theory, they were already receiving the value of CalFresh benefits within their SSP grant at $10. The challenge is that over time, the value of CalFresh benefits has increased with the rate of inflation, while the SSI cash-in amount, $10, has remained flat and lost relative value. This means that many SSI recipients living on very limited budgets intended to cover all basic needs are likely to have unmet food needs and are unable to apply for CalFresh. Fast forward to this year with Assembly Bill AB 1811, the fiscal year 2018-19 Human Services Omnibus Trailer Bill, also known as the state budget, that reverses the policy known as cash out. This means that people receiving SSI/SSP will be able to apply for CalFresh on or after June 1st, 2019, and, if otherwise eligible, receive food benefits. Excuse me. There will be no change to the combined SSI/SSP benefit amount. This is an important point, and we have received a number of questions in this area. So I will reconfirm that there will be no change to the SSI/SSP benefit amount as a result of this policy change. Especially important to note for our webinar today is that for CalFresh, all SSI/SSP recipients are considered elderly and/or disabled. So we are expecting a large influx of new elderly and/or disabled individuals qualifying for CalFresh as a result of this policy change. This makes now a great opportunity to refresh ourselves on rules that may be of particular importance to the elderly and/or disabled individuals applying for CalFresh. So with that, let's move on to discuss CalFresh eligibility rules for the elderly and people with disabilities. First, we will discuss who we mean by the elderly and people with disabilities. People are considered elderly for CalFresh purposes if they are 60 years or older. People are considered disabled for CalFresh purposes if they are receiving disability or blindness payments under the Social Security Act, or receiving supplemental security income, SSI, benefits for disability or blindness, receiving certain other disability-based benefits, such as from railroad retirement or Veterans Affairs, receiving Medi-Cal services because of a disability, or interim assistance, emergency general relief, while waiting to get SSI/SSP because of a disability approved by the Social Security Administration. Again, all SSI/SSP recipients are elderly and/or disabled for CalFresh. While elderly is defined as 60 years of age or older, people with disabilities can, of course, be any age. Now that we have identified the population we are focusing on, let's discuss an important distinction that this population has regarding the gross and net income test. Households that include an elderly and/or disabled member, which again, for the purposes of this webinar, are all households with an SSI/SSP recipient, are not subject to the gross income test for the purposes of determining CalFresh eligibility. However, the household must meet the net income test of 100% of the federal poverty level, FPL, for the household size. Allowing the most possible deductions the households are eligible for can help them meet the net income test. In order to understand how important deductions are for this population, let's move on. Deductions play a critical role in ensuring that all households, not just SSI recipients, receive all the CalFresh benefits for which they are eligible. Deductions allow expenses, such as child care and medical expenses, to be considered when determining a household's income. The amount of the expense is deducted from the household's gross income to determine the household's net income, and from there, the household's monthly benefit amount. With the implementation of the reversal of SSI cash out, assessing household expenses and deducting the corresponding expense amount will allow clients and administrators to maximize benefits for a particularly vulnerable population. The first deduction we will talk about is the standard medical deduction, or SMD. Who qualifies for this deduction? Well, this deduction is only for households with elderly and/or disabled members incurring verified medical expenses of over $35, but under $155 per month. It's the most beneficial deduction for households who incur medical costs of less than $155 per month. Households eligible for the SMD can have $120 deducted from their gross income to determine if their household meets the CalFresh net income limits to qualify for CalFresh, and when their CalFresh benefit amount is being calculated. To be eligible for the SMB, households must verify that they incur more than $35 a month in qualifying medical expenses. Continued medical expenses do not need to be re-verified at CalFresh recertification to qualify for the SMB. So what about households with medical expenses higher than $155 a month? Households with medical expenses over $155 can benefit from the excess medical deduction. With this deduction, households can deduct their actual verified medical expenses over $35. So by documenting these expenses, households are able to deduct more than the $120 standard medical deduction, and by doing so, can help the household qualify for more CalFresh benefits. Verification should be provided at recertification for previously unreported medical expenses and total recurring medical expenses that have changed by more than $25. So to review, the appropriate medical expense deduction to apply depends on how much the monthly medical expenses are for the household. Households with medical expenses under $35 a month are not eligible for a medical deduction. Households with verified medical expenses over $35 a month, but under $155 a month, qualify for the standard medical deduction of $120 a month. And any households with verified medical expenses over $155 a month can deduct actual medical expenses in excess of $35 a month. So budgeting for a verified medical expense that occurs each month is fairly straightforward. It is counted as a monthly expense for the rest of the certification period. But not all medical expenses happen exactly once per month. So how do we budget expenses that happen at different times? Budgeting medical expenses properly depends on how often they occur. For a medical expense to be considered fluctuating, the second column, the medical expense must be 1, regular recurring, and 2, reasonably anticipated. Those fluctuating expenses are counted by either averaging them over the entire certification period or averaged over the interval between the billings. A large or one-time medical expense can either be averaged over the certification period or counted as a one-time deduction. So, now that we have discussed the types of medical deductions, let's discuss the various types of medical expenses. A wide range of medical expenses are allowed. Qualified medical expenses may include, but are not limited to, the cost of health insurance premiums, co-payments for appointments or prescriptions, acupuncture, chiropractic, or herbal treatments, healthcare supplies and equipment and incontinence supplies, maintaining care attendants, home health aides, homemakers, or child care services necessary due to age or illness, over-the-counter drugs, ointments, or other treatments that are recommended by a licensed healthcare practitioner. This excludes nutritional drinks or other dietary supplements. Eyeglasses, contacts, contact lens solutions, hearing aids and batteries, and dental care and dentures. A less obvious allowed expense is the cost of public or private car transportation to healthcare appointments and pharmacies. As a reminder, households need to initially provide verifications of medical expenses for at least $35 in order to use the standard medical deduction. If they are unable to provide verification, they will not be allowed to utilize the deduction. However, a lack of verification shall not hold up an eligibility determination. So if the household is unable to provide medical expense verification, benefits shouldn't be denied just for that reason. Instead, the household should be evaluated for food benefits without allowing the deduction. A recertification or periodic report shall not be considered incomplete due to a lack of verification of medical expenses. Any needed medical expense verifications can be turned in later. Verification of medical expenses can be provided at any time. The CalFresh supplemental form for special medical deductions, the CF31, is an optional form that may be used for reporting medical deductions and is available on the CDSS website. It has a place to report the type of medical expense, the name of the elderly or disabled person, the amount of the expense, how often the expense occurs, and if the household is to be reimbursed for any part of the expense, such as by insurance. The form can be useful because this is information a county would need to properly evaluate and budget medical expenses. Additionally, some information provided on this form may not be available on verification, such as a medical bill or receipt, like how often the expense occurs. So let's recap medical expenses and deductions. Explore whether newly eligible SSI, SSP recipients have verified medical expenses above $35 a month at initial certification, periodic report, recertification, or at voluntary request when implementing the policy change. Explore whether newly added SSI, SSP recipients have verified medical expenses above $35 a month. They probably do. Allow households to claim the medical deduction for the remaining length of the certification period or for the length of the new certification period if completed at initial certification or recertification. Ensure the household is able to claim the appropriate medical deduction. And as mentioned in the previous slide, if verifications are not submitted, the CWD will continue to determine eligibility without the deduction. Okay, that was a lot of information on medical expenses and deductions. I'd like to pause for just a couple of seconds here so to allow you a bit of time to submit any questions you can have before we move on to excess shelter and moving forward. So I'm going to pause for just a moment to see if there's, have you get your questions in. Okay, we've received some questions so far. Thank you very much. Again, we'll keep collecting all of the questions and go over them at the end if there's time. So we need to switch gears and discuss the next deduction, which is the excess shelter deduction. In general, CalFresh households may deduct the actual amount of monthly shelter costs in excess of 50% of the household's income after all other applicable deductions have been applied. For most households, there is a cap for the excess shelter deduction. In general, the amount deducted shall not exceed the current maximum for the excess shelter deduction, the cap. That is, unless the household includes at least one elderly and/or disabled member. Then the household is to be allowed an uncapped deduction. Reminder, as the policy change is implemented, if the SSI recipient is the only elderly and/or disabled member in the household, then the shelter deduction should be recalculated when the SSI SSP member is added to the household. For more information on when a previously excluded SSI SSP member is added to an ongoing CalFresh household, please refer to our webinar from January 22nd on a policy overview of reversing SSI cash out which can be found on our Reversing SSI Cash Out webpage. The next type of deduction we will cover is the dependent care deduction. CalFresh households, including those with an elderly and/or disabled member, may claim the dependent care deduction if the dependent care is necessary to allow a household member to accept or continue work, or attend school, or attend training to prepare for work. We went over who qualifies for the dependent care deduction, but what is the actual deduction? Just a second, I believe that it went past one. I'm sorry. Okay, so we went over who qualifies for the dependent care deduction, but what is the actual deduction? The deduction is for the actual cost of dependent care, including child care or care for an elderly and/or disabled member, regardless of age. Many people think this deduction is only for child care, but it may actually apply to households with elderly and/or disabled dependent members. This deduction could potentially help households with SSI, SSP recipient members. There is no cap on the amount of dependent care expenses that may be deducted. Note that a single expense can only be considered a dependent care expense or a medical expense. It cannot be both. So in order to verify these expenses, California allows for self-declaration of dependent care expenses unless questionable. A dependent care cost affidavit form, the CF-10, to self-declare the expenses is shown on the right. The form is available on the CDSS website. The flexibility of allowing self-declaration provides counties with the ability to help households more efficiently claim their dependent care deductions. Okay, let's go over a few reminders for the dependent care deduction. Workers are encouraged to explore whether households with newly eligible SSI, SSP recipients may have dependent care expenses. If the household does have dependent care expenses, work with the household to get any needed verification, and then allow households to claim the dependent care deduction for the remaining length of the certification period, or for the length of the new certification period if completed at initial certification or recertification. As a reminder, it is encouraged that the counties and application assisters work with the applicants to maximize deductions without delaying the benefit determination. Again, I'd like to pause to give you a moment to submit any questions on the deductions. All right, let's do a quick refresher on categorical eligibility. This was also covered in the policy overview Reversing SSI Cash Out webinar on January 22nd. Households receiving benefits from certain low-income assistance programs, including SSI, are considered categorically eligible, CE, for CalFresh. This is true for households where all the members are receiving SSI. Again, due to the policy change allowing SSI recipients to receive CalFresh, this is a great time to review this policy topic. Under categorical eligibility, preliminary CalFresh eligibility factors for the household do not need to be redetermined because those eligibility factors have already been determined by the other assistance program. In this case, for example, we know that SSI recipients are low income based on the fact that they applied for and are receiving SSI. Categorical eligibility does not result in automatic CalFresh eligibility. The counties must still determine the household benefit level. What you need to know about categorical eligibility is that households that include only SSI recipient members are very likely eligible for CalFresh, and that's why they are considered categorically eligible. Okay, next I'd like to discuss the Elderly Simplified Application Project, ESAP, and give a brief overview of ESAP and how this project lends itself to the reversal of the SSI cash-out policy. For those of you who listened to the initial webinar in January, you may recall that we mentioned ESAP, the Elderly Simplified Application Project. ESAP is designed to improve access among the state's low-income elderly and disabled population. So who qualifies for ESAP? Well, households where all members are elderly and or disabled and the household has no earned income. So these are households where either there is no income or the only kind of income is considered unearned for CalFresh, such as SSI, SSP income, Social Security retirement, or disability income. Households that qualify for ESAP have a recertification period of once every 36 months or 3 years, which means instead of needing to recertify CalFresh every year, the household only needs to recertify every 36 months. Additionally, there is no interview required at the time when the household completes their recertification. However, they do need to complete an interview at initial intake. And of course, electronic data matches are used to the greatest extent possible to help reduce client-provided verification. So if this next slide looks familiar, it is because this information was also covered during the policy overview, Reversing SSI Cash Out webinar on January 22nd. However, this is an important modification in the first 6 months of the reversal of SSI Cash Out. All newly eligible SSI, SSP only households determined to be CalFresh eligible between June 1st, 2019 and November 30th, 2019 will be assigned a shortened certification period. Excuse me. These will be assigned based on the last digit of the household's case number. So that is the first column there on the table. These newly eligible households have all elderly and or disabled members. The next 2 columns is where it gets a little bit different. The second column of the table on the slide shows those newly eligible SSI-only households with earned income. And those households will be assigned a certification period between 19 and 23 months, again, depending upon the last digit of their case number. The third column on the table shows those newly eligible SSI-only households with no earned income. So those are the ESAP households, and those households will be assigned a certification period between 31 and 35 months. So this staggering of the recertification periods after the initial implementation of the policy change was designed to help ease the administrative burden on counties when the first wave of recertification comes through. So to explain a little bit more detail, those newly eligible SSI-only households with earned income would normally have a 24-month certification period. But in this case, those newly eligible households determined eligible between June 1st and November 30th, 2019 will be assigned a shortened certification period between 19 and 23 months, depending upon what the last digit of the case number is. And, sorry, those newly eligible SSI households with unearned income, the ESAP households, will normally have a 36-month certification period, but in this case, when the household has been determined eligible between June 1st and November 30th, 2019, those will be assigned a shortened cert period between 31 and 35 months, again, depending upon what digit of their case number is. So after this initial shortened period, households will be assigned their normal 24 or 36-month certification period. I hope that clears that up a little bit. Okay, Moving on to the separate household status rule. A household for CalFresh purposes is a group of people living together that purchase and prepare food together. However, sometimes elderly and/or disabled people are allowed to be counted as a separate household if certain conditions are met. To qualify as a separate household under this rule, an elderly household member and his or her spouse must meet the following conditions. They must be both elderly and disabled, and must be unable to purchase and/or prepare meals because of a disability, and the income of the other members with whom the individual resides does not exceed 165% of the federal poverty level. If an elderly person, either alone or together with their spouse, is eligible to be counted as a separate household, the counties do not need to count the income of other people living in the home when calculating the CalFresh benefit. The 165% federal poverty level is never used to determine eligibility for households with an elderly and disabled member. It is only used to determine whether to certify the elderly and disabled member and his or her spouse as a separate household. The separate household status rule may help some elderly and disabled people living with others to qualify for more benefits. Now we will discuss the Restaurant Meals Program. As many of you know, most CalFresh recipients are not typically able to purchase hot or prepared foods with their CalFresh benefits. The Restaurant Meals Program, or RMP, allows elderly, disabled, and/or homeless individuals to purchase hot and prepared food at qualifying restaurants with their CalFresh benefits. This program is available in recognition that not all elderly, disabled, and/or homeless individuals may be able to prepare their own food due to a lack of adequate cooking facilities or other challenges. This is an optional county program, so it's not available in all counties. At this time, 10 counties, with more coming soon, are participating. You can find out more about participating counties by clicking on the link in this slide. So RMP is the last CalFresh eligibility topic we have for today. Overall, the CalFresh eligibility rules for the elderly and people with disabilities provides many tools for providing service to this population to assist them in accessing food benefits. In particular, counties and assisters are encouraged to work with applicants to identify their full amount of allowed deductions to help ensure they receive the maximum amount of benefits they are eligible for. So before we wrap up today and get to the Q&A, I want to quickly review a few related resources where you can get more information. First, one last plug for the next webinar in this series, a refresher for CalFresh eligibility rules for residents of institutions from 10 o'clock to 11 a.m. on Tuesday, February 19th. To register for the Residents of Institutions webinar, please visit the Reversing SSI Cashout webpage at cdss.ca.gov/CalFreshSSI. Next, a reminder that we are hosting our next all-stakeholder meeting on Wednesday, March 13th, 2019, from 1 to 2:30 p.m. by phone, webinar, or in person here at the CDSS headquarters in Sacramento. You can also go to the cdss.ca.gov/CalFreshSSI webpage to register and for more information. And finally, a list of relevant policy guidance that's also available on our website, but is compiled here for your convenience. Okay, so we'll now begin the question and answer portion of the webinar and discuss questions we haven't yet addressed. Again, I just wanted to let you know that if we aren't able to answer your questions now, we will provide responses, and those will be posted within the next few days on our web page. So right now, I'm going to go ahead and look at some of the questions. Okay, so the first one I see here is, do we need proof that they paid the expense or just that they incurred it? And what are acceptable verifications besides receipts? It's a great question. There are multiple types of acceptable verifications for medical expenses, and counties and application assisters should work with the applicants to help them submit what is needed. Some types of verifications for the medical expenses include medical bills or receipts, medical transportation bills or receipts, health or dental insurance policies or premiums, Medicare card, that's for the Medi-Cal only, doctor statement or disability finding by an agency, and medical verification form. Okay, let's see. If the CF31 is not input by our consortia by the implementation date, are we to use the CF31 on the state site? The CF31 is an optional form for reporting medical expenses, and counties can use the form, the state on the website, per your usual business practices. The form is only the one way to help the CalFresh applicants and recipients to report their medical expenses. Okay, looking down here. Let's see, are newly eligible people being told that they are there are over-the-counter prescribed items that will be covered? Okay, this is a good practice for eligibility workers and application assisters to let the applicants know about all their possible deductions and what expenses can count towards those deductions. And I believe that if those over-the-counter ones have been prescribed by a practitioner, that those would also be counted. So that should cover that. Okay, let's see. This is regarding income. If someone is also receiving SSA benefits, does that count towards their monthly income? Yes, SSA income counts as unearned income for CalFresh. Okay, and this is one about the separate household rule. Let's see, the separate household section doesn't address if the purchase and preparer are separate. I am assuming there is no change to that rule. Purchasing and preparing separate would also allow them to be separate. I guess that's the question. Would that also allow them to be separate? So yes, people living together but purchasing and preparing separately are counted separately unless they are mandatory to be counted together, such as spouses with spouses and parents with younger children. Okay, so let me look through a couple more. Okay, we suggest adding service animals to the previous slide. Yes, this will specifically apply to our blind SSI population. Thank you very much. That is an important distinction in that service animals can also be counted as an expense, a medical expense. So thank you very much for that, and we will make sure that that gets added onto the to that slide. Let's see. There's some great questions. There's some, though, that we're going to probably have to look into a little bit more, and I apologize for that. let's see, sorry. A lot of these are kind of the same too, so I apologize. Just a moment. Okay, this is an important distinction too, so this was a good question. If the medical expense is exactly at $35, do we allow the SMD? No. The medical expense actually has to be $35.01. So we will make that change also on the slide. Thank you very much. So if it's at $35, no deduction. There's something about Part B, but I don't know about the Part B, so we're going to have to come back to that one. Is there a link to access these slides online? There will be. Check probably maybe the early part of next week. We will have the website up on the slideshow on the website. So you can check back then. Here's another question about the dependent care. So how do you determine whether dependent care is a dependent care deduction or a medical deduction? If it's going to be more beneficial to get you a higher medical deduction, it may be more worthwhile. I mean, you just can't have them be both. So if it's more worthwhile to use it as a medical expense, then that's the way you should go if you can get a higher deduction that way. But they just cannot be both. Okay, still looking down. There's quite a few questions, so I apologize. This is a nice question. I'm not sure if I can particularly answer it, but I just kind of want to throw it out there for the counties just to maybe think about. Will there be any sort of checklist provided on what deductions to check for? That might be maybe more of a county policy operations type of thing that you might want to start looking into. But at this point, we just haven't thought about or we don't have that on our radar to do that. So that might be more of a county policy type of thing. Okay, if dependent care expenses are not reported on the SAR-7, is the SAR-7 considered incomplete? No, it is not considered incomplete. Just means that they didn't answer it. Okay. You guys have so many questions, and I appreciate it. Again, a lot of these I actually have to look into, so I apologize, but they will be posted on the website. So I'm not sure what this question means, but it says, will the cycle also be adjusted for the new SSI-only households during the first 6 implementation months? I'm assuming that that's the adjusted certification period, and that is for those SSI-only households for those first 6 months. So yes, I think that that's what the question is, but it's only for those first 6 months. I apologize about sound issues. So this one says, can you please cover the households determined categorically eligible receiving the minimum benefit even if they are over the gross income threshold? So at that point, it's only households of 1 or 2 that would receive the minimum benefit. And if it's a household of 3 or more, they would, and if there's no benefit allotment for those households, they would receive 0 benefit and then basically be denied. So but they would go by what their household size is. So households of 1 or 2 that are over the gross income would still meet the minimum benefit, and I believe it's $16 right now. Okay, someone had asked if Kern County was currently part of the Restaurant Meals Program, and no, they are not part of the Restaurant Meals Program. I will actually let you know who is part of it right now. It's Alameda County, Los Angeles County, Orange, Riverside, Sacramento, San Diego, San Francisco, San Luis Obispo, Santa Clara, and Santa Cruz. And I believe Monterey is coming on soon, and I thought Fresno was too, but I may be wrong about Fresno. So, but that is also listed. We have it on our own website, and it's also it's at ebtproject.ca.gov, and it should be able to get you in there from there. Okay. When will this presentation be available? Hopefully by the early part of next week. At what age are individuals considered elderly? That's 60 years and older. With the staggered recertification period, say 31 months, the SAR 7 is due at 12 months, 24 months, then we'll recertify them. Oh, that's a great question. I will have to look into that one. I'm not exactly sure. Okay, are the service animal expenses solely for the blind population or all disabled? It would be for all disabled. The all disabled population, yeah. Do all SSI clients qualify for RMP? I believe that they do, and I believe that it is actually on their EBT card. It will actually, the system puts it in there for them. So even if they are not in a county that does RMP, it will still show that they are RMP, even though they won't be able to use it for anything, which is unfortunate. That's why we encourage counties to look into doing RMP for their counties. There are so many great questions. Is a sworn statement acceptable verification of medical expenses if the customer has no other proof? So self-attestation? my gut is to say that that is fine, but I need to look into that a little bit more. Sorry. How do they know what restaurants? Participating restaurants are actually listed on our own website, and you may want to also check the county's website to see what restaurants have opted into doing the Restaurant Meals program. Okay, a lot of these, like again, are the same. Are we planning on creating desk guides for EWs on what types of questions to be asked during the applicant in order to be capturing expenses for SMD or other deductions? That isn't something typically that policy does. That would be at the county level. And their training unit, so that may be something that they would have to look into. Is June 1st, 2019 a for sure date for SSI clients to apply? Yes, that is the date that we have been told, and that's the date that we are going with. So June 1st is what it is. On one of the slides for the standard medical deduction, it stated that medical expenses were not required to be verified at recertification. They do not need to be re-verified at recertification unless it changes by more than $25 or there's an additional verification that hasn't been reported yet. Okay, I think that that's about it for right now. We can, like I said, there's quite a few questions on here. A lot of them are repetitive, which is fine. Oh, thank you. The current minimum benefit is $15. Thank you. As soon as I said 16, I knew I was wrong. So thank you, $15. Oh, the slides are available the next day. Well, thank you. I don't think that that should be a problem. I think that we should be able to at least post the webinar up by tomorrow, the slides by tomorrow. I'm not sure about how the recording goes and everything, but we can for sure put the webinar up by tomorrow. And then the questions, though, will probably come sometime next week. And let me see if this is the... Great question. Okay. Okay. So with that, I think that we're good. And apologies if we didn't get to your question. Again, there were so many, and a lot are a little bit different, but kind of repetitive. So, but that's okay too. We love all the questions. We will go ahead again, like I said, and get this. Hopefully, the webinar will be posted by tomorrow. The audio, I'm not sure how long that takes, so I apologize for that. And the questions will be up at some point next week. And with that, we thank you all, and we look forward to seeing you in the next webinar series on the 19th. All right. Thank you so much.